our team has done here of split liver. The esteemed surgeons who are here on the dais with us. So I just want to outcome. We are privileged in this. We thank you all for being here.
One part of the liver, right lobe usually, to the other. Multiple, more than 1,000 patients waiting for liver at this moment, and there is a severe shortage. So a lot of people die on waiting list, waiting for the organ. So in that case, we have to use different strategies to make sure that we can increase the donor pool. Basically, make sure that there are enough organs for patients waiting on the waiting list. And for the patients waiting list, patients who are waiting on the waiting list, it's a severe issue. As in, they don't know what to do, and it is pretty bad experience as such. So to increase the donor pool, one of the strategies used is split liver transplantation. What's unique about this case is
for two patients, that is where the process starts from. And once we identify a organ donor who's suitable, whose liver can be split into two halves, then the next step will be to identify, how to do it. Like, we have to do multiple scans, identify those blood vessels, cut the liver into two halves. Whatever blood vessels needed reconstruction, we have to reconstruct them on the back table. And, after doing all this, the new liver has to go back into the recipient in a short span of time. And because there are, if you imagine, there were totally about 3 surgeries happening at the same time.
And is all transplant recipients have a failing organ to start with. And a major organ like liver, if not functioning, we can understand their immunity is going to be very down. And the moment they receive an organ from a donor, our body, a natural response is to push it away from the body, a process what we call rejection. So we use medicines to kind of regulate these processes. So all collectively will compromise the patient's immunity, and that with them puts them at a high risk for infections. So we, the transplant organization, are very conscious about that and have taken every effort to make sure that a new infection doesn't affect them or an existing infection doesn't flare up during the post-transplant period, which is very crucial for successful outcomes. So in our organization, we keep this transplant cohort, if I may use the word cohort, because we have a very successful and robust transplant program, including the liver programs, we have renal transplant programs, we have the heart and lung transplant programs, we have the bone marrow transplant program. So this cohort is the most vulnerable people in the hospital. So whatever decision we take in the hospital, they are at the center and everybody works around them. So like they mentioned, it is an outcome of a collective effort of a huge team, right? From our coordinators who follow up with the transplant recipients and the donors, and the intraoperative support team, right from the scrub nurse to the assist nurse to the OT committee, right from the nursing team under the able leadership of a nursing superintendent, the infection control team, the housekeeping and the maintenance. We make sure that even the air that enters the OT facility and the post-transplant care facility is taken care of.
The second question, very high, at least in Karnataka. It's very low and you will die in the list. It's called wait. The infection risk post-transplant for usually not more than 1 year for transplant. So some liver transplantation we've done, in which a brain dead donor. So they have one liver, same liver. Called this press meeting today is what we have done today is to make sure organ donation is key. Now we have more patients needing organ than somebody who can donate it. So how do we adjust the discrepancy? One of the innovative method to do is split liver transplantation, in which a brain dead person who is willing to donate the organ, what we do is we cut the liver into 2 halves and transplant in two different patients so that we can save two lives instead of one with one liver. It is very challenging and very complex procedure. Yakandre, we cannot keep the liver outside the body for too long. So it requires lot of logistic this thing, everything should fall in place. So in this case, we could reduce keeping the liver outside the body for less than 2 hours in both our patients. So that required lot of calculations, make sure everything places right time things were done, 3 surgeries were going at the same time. So it is very complex, and I'm very glad that we could achieve this. It is significant to talk to you about. You may not understand it, but these are very, very rare cases. I don't think multiple cases like this are done. It's been done, but I don't think it is done so commonly, because there are risks involved and there are a lot of logistic issues involved and a lot of team membership requirement. So if you have all this, then you can do this case.
ಒಂದು ಲಿವರ್ನ ಇಬ್ಬರಿಗೆ ಹಾಕ್ತೀರಾ ಅಂತ ಹೇಳಿದ್ದೀರಾ, ಆಪ್ರೇಷನ್ ಮಾಡ್ತೀರಾ, ಚೇಂಜ್ ಮಾಡ್ತೀರಾ, ಲೆಫ್ಟ್ ಇರ್ಬೋದು ರೈಟ್ ಇರ್ಬೋದು, ಅದು ಎಷ್ಟು ದಿನ ಲೈಫ್ ಇರುತ್ತೆ ಸರ್? ಎಷ್ಟು ದಿನ ಒಂದು ಪೇಷಂಟ್ ಬದುಕ್ಬೋದು ಸರ್ ಅದು?
ಸೊ ಅವ್ರದ್ದು ಲಿವರ್ ಏನು ಇನಿಷಿಯಲ್ ಪ್ರಾಬ್ಲಮ್ ಬಂದಿಲ್ಲ ಅಂದರೆ ಲೈಫ್ ನಾರ್ಮಲ್, ಬಿಕಾಸ್ ಅದು ಲಿವರ್ ಈಗ ಅವ್ರು ಅರ್ಧ ಲಿವರ್ ಕೊಟ್ಟಿದ್ದೀನಿ, ಅದು ಪೂರ್ತಿ 100% ಆಗಿದೆ ಆಲ್ರೆಡಿ, ಗ್ರೋ ಆಗೋಗುತ್ತೆ. ಸೊ ಲಿವರ್ ಗ್ರೋ ಆಗುತ್ತೆ.
ಏನು ಇದೆ ಎಫೆಕ್ಟ್ ಏನು ಆಗೋದಿಲ್ಲ ಸರ್?
ಸೊ ಸ್ಟಾರ್ಟಿಂಗಲ್ಲಿ ಏನಾದರೂ ಎಫೆಕ್ಟ್ ಇದ್ದರೆ ಅದರಿಂದ ಪ್ರಾಬ್ಲಮ್ ಬರ್ಬೋದು, ಬಟ್ ಅಟ್ ದಿಸ್ ಟೈಮ್ ದೇ ಹ್ಯಾವ್ 100% ಆಫ್ ದ ಲಿವರ್, ಸೊ ದೇ ಕ್ಯಾನ್ ಲೀಡ್ ಅ ನಾರ್ಮಲ್ ಲೈಫ್.
ಎಷ್ಟು ದಿನ ಇರ್ಬೋದು ಸರ್? ಫಾರ್ ಎಕ್ಸಾಂಪಲ್
ಮೋಸ್ಟ್ ಆಫ್ ಅವರ್ ಪೇಷಂಟ್ಸ್ ಡೈ ವಿತ್ ಫಂಕ್ಷನಿಂಗ್ ಲಿವರ್.
ಈಗ ಎಷ್ಟು ಪೇಷಂಟ್ ನೀವು ಮಾಡಿದ್ದಾರೆ ಸರ್ ಸ್ಪರ್ಶ್ ಹಾಸ್ಪಿಟ್ಲಿಂದ? ಎಷ್ಟು ಜನಕ್ಕೆ ಮಾಡಿದ್ದೀರಾ? ಎಷ್ಟು ಜನ ಕ್ಯೂರ್ ಆಗಿ ಎಷ್ಟು ಜನ ಬೆಟರ್ ಆಗಿದ್ದಾರೆ?
ಸೊ ನಾವು ಸ್ಪರ್ಶ್ ಯಶವಂತಪುರ RR ನಗರಲ್ಲಿ ಎರಡು ಜಾಗ ಮಾಡ್ತಿದ್ದೀವಿ. ವಿವ್ ಡನ್ ಮೋರ್ ದೆನ್ 100 ಕೇಸಸ್ ಇನ್ ಓನ್ಲಿ ಸ್ಪರ್ಶ್. ಬಿಫೋರ್ ದಟ್ ಇನ್ ಮಣಿಪಾಲ್, ಐ ವಾಸ್ ಇನ್ ಮಣಿಪಾಲ್, ವಿವ್ ಡನ್ ಮೋರ್ ದೆನ್ 150 ಕೇಸಸ್ ದೇರ್. And before that I was in Apollo and Dr. Mahesh was in Apollo, and we have collective experience of more than 2000 cases.
ಆಮೇಲೆ ಇನ್ನೊಂದಿಗೆ ಹೇಳ್ತಾ ಇದ್ದೀರಾ ನೀವು, ಇದು ಡೋನರ್ಸ್ ಬೇಕು ಅಂತ, ಅವ್ರಿಗೆ ಏನು ಹೇಳಕ್ಕೆ ಬಯಸ್ತೀರಿ? ಯಾವ ರೀತಿ ಅವರಿಗೆ ಕನ್ವಿನ್ಸ್ ಮಾಡ್ತೀರಾ?
ಸೊ ಕನ್ವಿನ್ಸ್ ಇಲ್ಲ, ಅದು ಒಂದು ಇರುತ್ತೆ. ಇದು ಡೊನೇಷನ್ ಹೇಗೆ ಅಂದರೆ, ನಮ್ಮದು ಒಂದ್ಸಲಿ ಡೆತ್ ಆಯಿತು, ನಾವು ಆರ್ಗನ್ ಡೊನೇಟ್ ಮಾಡಬೇಕು ಇಲ್ವೋ ಅಂತ ಒಂದು ನಿಶ್ಚಯ ಮಾಡಬೇಕು, ಮತ್ತು ಆ ನಿಶ್ಚಯ ಇದೆಲ್ಲ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಗೆ ಹೇಳಬೇಕು. ಯಾಕಂದರೆ ವೆನ್ ದೇ ಆರ್ ಡೆಡ್, ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ ಟೇಕ್ಸ್ ದಟ್ ಡೆಸಿಷನ್. ಅದು ಹೇಳಿದಾದ್ಮೇಲೆ ಡೊನೇಷನ್ ಮಾಡೋರು, ಅದು ಇಲ್ಲಾಂದರೆ ಇಟ್ ವಿಲ್ ಗೋ ಅಂಡರ್ ದ ಸ್ಯಾಂಡ್ ಆರ್ ಗೆಟ್ ಬರ್ನ್ಡ್. That can save up to 8 life. If it is a thing, you can save up to 8 life. So ಹೋಗುವಾಗನು ನಾವು, they will always remember their donor, that he saved their life. There were 2 kidneys, 1 heart, lungs, they were taken. All those guys will remember that, you know, somebody donated me his organs and I'm living with that.
ಎಷ್ಟು ಕಾಸ್ಟ್ ಸರ್ ಇದಕ್ಕೆ? ಈಗ ಸಪೋಸ್ ಇದು ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಇದಾದರೆ, ಲಿವರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ನೀವು ಮಾಡಿದಾಗ ಎಷ್ಟು ಕಾಸ್ಟ್ ಆಗ್ಬೋದು, ಯಾವ ರೀತಿ ಆಗ್ಬೋದು ಸರ್?
ಕಾಸ್ಟ್ ಅದೇ ಒಂದು ಇಂಪಾರ್ಟೆಂಟ್ ಕ್ವಶನ್. ಎವ್ರಿಬಡಿ ಥಿಂಕ್ಸ್ ಅಬೌಟ್ ಕಾಸ್ಟ್. ರೈಟ್ ಅವೇ ಅವ್ರ ಕಾಸ್ಟ್ ಜಾಸ್ತಿ ಇದೆ ಅಂತ ಸ್ವಲ್ಪ ಹೆದರಿಕೆನೂ ಆಗುತ್ತೆ. ಬಟ್ ನಾನು ನೋಡಿರೋ ಪ್ರಕಾರ ಲಿವರ್ ಡಿಸೀಸ್ ಇಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿ ಡಿಸೀಸ್. ಅದು ನೀವು ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡ್ತಿರೋ ಇಲ್ವೋ ಅಷ್ಟು ದುಡ್ಡು ಖರ್ಚಿಗೆ ಆಗೋಗುತ್ತೆ. ಇವಾಗ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡಲಿಲ್ಲ ಅಂದರೆ ರಿಪೀಟೆಡ್ ಅಡ್ಮಿಷನ್, ಹಾಸ್ಪಿಟಲ್ ಅಡ್ಮಿಷನ್, ಆಲ್ಬುಮಿನ್ನು, ಅದು ಮೆಡಿಸಿನ್ ಕೊಟ್ಟು ಅಷ್ಟು ದುಡ್ಡು ಖರ್ಚಿಗೆ ಆಗೋಗುತ್ತೆ. ಸೊ ಇಫ್ ಯು ಹ್ಯಾವ್ ಟು ಕಮೆಂಟ್, ಕಾಸ್ಟ್ ಬೆನಿಫಿಟ್ is better. Cost benefit of liver transplantation is much better than cost benefit of not doing liver transplantation. ಅದು ನಾನು ಹೇಳ್ತೀನಿ ನಿಮಗೆ 100%. There is no doubt about that. So cost benefit of liver transplantation is better. So if anybody needs liver transplantation, people think that we are saving money by not getting it transplanted, but eventually they end up spending so much money. Unfortunately, that is the case. ಲಿವರ್ ಡಿಸೀಸಸಲ್ಲಿ ನಾವು ಸುಮ್ಮನೆ ನೋಡಿ ನಮ್ಗೆ ಗೊತ್ತಾಗಲ್ಲ. ವಿ ಹ್ಯಾವ್ ಟು ಡೂ ಎವ್ರಿ ಟೈಮ್ ವಿ ಸಿ ದ ಪೇಷಂಟ್ ವಿ ಹ್ಯಾವ್ ಟು ಡೂ ದ ಬ್ಲಡ್ ಟೆಸ್ಟ್. ಎವ್ರಿ ಟೈಮ್ ದೇರ್ ಇಸ್ ಅ ವಾಟರ್ ಇನ್ ದ ಬೆಲಿ ವಿ ಹ್ಯಾವ್ ಟು ರಿಮೂವ್ ದ ವಾಟರ್ ಇನ್ ದ ಬೆಲಿ. ಎವ್ರಿ ಟೈಮ್ ದೇ ಗೆಟ್ ಇನ್ಫೆಕ್ಟೆಡ್ ವಿ ಹ್ಯಾವ್ ಟು ಅಡ್ಮಿಟ್ ದೆಮ್ ಆ್ಯಂಡ್ treat them. They get a lot of albumin. One albumin costs around 7,000, 8,000 rupees. They need to quit. So it is costly disease. So but cost benefit of liver transplantation is very good.